recording started.
Of homeopathy. It is a very relevant topic today because of the current situation, and very
Diksha,
often.
sorry,
Yes, sir?
can you just start again? You were on mute when you started.
Oh, okay. I'm not on mute, no?
I just unmuted you.
Okay, okay. All right. I'll start again. Good evening and welcome to another session with Sujata Mohanty. Today's topic is scope and limitations of homeopathy. It is a very relevant topic in today's times, given the current situation of the pandemic that is coronavirus. And homeopathy has come to the forefront and receiving a lot of attention. So even in our daily practices, we can see that people come and ask us a lot of questions on what we can treat and how much scope there is in getting better. So let us deal with this topic, scope and limitations of homeopathy. It has been covered very well in Stuart Close's book, and today we're going to discuss it in detail. Okay, Sujata, take it over.
Okay, ma'am.
Hmm.
Very good evening to everyone. So, first of all, thank you so much, Kartik sir, for giving me this opportunity, and Diksha ma'am for guiding me through all this. So, like you all know about today's topic, it's scope and limitations of homeopathy. And according to me, and I think that this is the most underrated topic. No one talks about it in details. Like as a BHMS student, if we are choosing a medical system or a pathway as our career, so it is very important for us to know what scope it poses and what are its limitations. So, so that's why I will discuss some important points about scope and limitations of homeopathy. Okay. So first, what we mean by scope of homeopathy. Scope of homeopathy means in those situations or cases where homeopathy is applicable and it will help. It will cure those cases, those disorders. So that is the scope of homeopathy. And limitations of homeopathy means in those cases where homeopathy is not applicable. It can't help, or if it is applicable, then to a certain limit. So that is the limitations of homeopathy. So Stuart Close, in his philosophy, chapter 4, discussed about this topic in detail, and he just put this lines in a paragraph, and I just quoted that here that this is his subject means the scope and limitations of homeopathy is the subject which has received two literary considerations by teachers and practitioners alike. As a result, we find on the one hand a few sincere but misguided enthusiasts attempting the impossible and bringing ridicule upon themselves. Like there is a group of people who don't know what is the limitations of homeopathy in details, and they just pick those impossible cases where homeopathy can do anything and think that homeopathy is useless and bringing ridicule upon themselves that they can do anything as a homeopath. And on the other hand, the great majority, ignorant of the higher possibilities, means the higher scope homeopathy poses, missing their opportunities and bringing discredit upon themselves and their art by resorting to unhomeopathic measures in those cases which could readily be cured by homeopathic remedies. So that's why it is very important for us to know what is the scope and what is the limitations of homeopathy, so that we can put in those both groups. So that's the importance of scope and limitations of homeopathy. And also, Schwartlow says that accuracy and efficacy in homeopathic therapeutics is possible to those who have clearly defined idea of the field. in which the principle of similia is operating. Principle of similia is the principle of homeopathy. In which field it can act, it can cure those cases. If we have those knowledge, then then we can cure those cases. Okay. So now we will discuss about scope of homeopathy. So in which cases homeopathy has a scope and it can cure those. So dynamic diseases means are those which are caused by inimical influences. Inimical dynamic influences derange the vital force, and we call those as maladies. And from this, the diseases arise a dynamic. So homeopathy, like we all know, that homeopathy is the science of vital dynamics. We all know that the inimical dynamic influence that we call the miasms derange the vital force, and then there is functional changes happening in the individual patient, irrespective of the name of disease or of its cause. We deal with those disorders that occurred by the derangement of vital force, and vital force is deranged by means of miasms, by means of dynamic um, inimical influences that we call miasms. So homeopathy deals with vital dynamics. So homeopathy's main object, our main aim is the restoration of order and harmony in vital functionings in the individual patient. So we have to restore that disordered vital force into normal order, and after that the functional changes are again come into the harmonious way in the individual patient. So that is the object of homeopathy. That is the aim as a homeopath. The effects of dynamic causes means that constantly disturbed the mind and body of the patient. Example, mental or psychical origin. Those causes, those dynamic causes may be of mental or psychical origin, or atmospheric origin, or thermal origin, or climatic, dietic, hygienic, contagious, infectious, etc. Can be cured effectively by homeopathy because those are called the dynamic diseases. So diseases arising from the bacterial causes or pathogenic microorganisms, here also homeopathy has a scope because this line proves, because in example if we take that the success of our pioneers in treating the cases like cholera, yellow fever, typhoid fever, malarial fever, diphtheria, tuberculosis, and pneumonia, etc., are the proof that homeopathy can act in those cases where there is a reason, there is a behind the scene, there is a microorganisms. So homeopathy can act in those cases, like it cures the current situation of COVID-19 cases as well, and successfully homeopathy cures the cases. So that is an example that homeopathy can also act in those cases as well, where there is a microorganisms is the cause. And according to Macramedica, there is a scope of Macramedica, homeopathic Macramedica, that is also included in the scope of homeopathy. So this is the line that in our Macramedica we have so many remedies for one disease and also one remedy for many diseases. So this line I learned from, like I listen from Diksha ma'am. She mentions these lines in so many webinars, like previous webinars. So I just thought that this is the most important scope of our homeopathic macramedica. So if you just read this line 3 to 4 times, then you will know that whole Macramedica possesses so much scope in various diseases. Like in our Macramedica, we have so many remedies for one disease. Suppose the disease is headache, and we have so many remedies. According to the symptomatology, we choose the remedy. But for headache, we have so many remedies, and also one remedy for many diseases. Also, if we take the Natromule, and we can give in so many conditions, we can apply Natromule. So that is the most important scope of homeopathic Macramedica. Our drugs are proved upon healthy human beings. We all know that our drugs are proved upon healthy human beings. So we can apply our drugs on mental condition or mental disorders as well. So homeopathy can also cure those mental conditions and mental disorders because we have so many mental symptoms and that is the that we get because our drugs are proved upon healthy human beings. So now we'll discuss about the limitations of homeopathy. So
Hi,
in those
Sujata.
cases, yes, ma'am.
Sorry, your voice is not clear. Can you just hold the microphone a little closer?
Okay, ma'am.
Yeah, please. Yeah, thank you.
So now we will discuss about the limitations of homeopathy. In those cases where homeopathy has can be applicable or if applicable has certain limit. So first is emergency cases. In most in the most urgent cases where danger to life and imminent death allow no time for the action of homeopathic remedy. Well, those are the most emergency cases, most urgent cases where there is danger to life and death allow no time for the action of homeopathic remedy. So we can't apply any homeopathic remedy to that case because it is an emergency condition. It needs the emergency aid. And then the sudden accidental case, asphyxia and suspended animation from lightning, from suffocation, from freezing, drowning, and poisoning. Here there is no disease to be removed because here there is no dynamic cause that deranges the vital force and produces the disease. So here no disease to be removed, but merely it is an obstruction and suppression of the healthy vital force. So here homeopathy has no role to play as a preliminary measure. Here mentions that the preliminary measure means at first homeopathy can do anything. It needs the emergency aid here because it is the accidental cases. And after effects and after that the effects arises, the symptoms arises, we can apply homeopathy. But homeopathy has no role to play as a preliminary measure in these type of sudden accidental cases. Then cases with irreversible organic changes. Examples: grossly damaged valvular diseases of heart, too advanced cirrhosis of liver, complete optic atrophy, advanced malignant conditions. Those are the conditions where there is already organic changes happened and those changes are irreversible. As we all know that homeopathic drug proving is discontinued before the drug produces any organic change in the body. This is we learned in homeopathic drug proving that homeopathic drug proving the drug is discontinued before there is any organic change happened in the body. So our Macramedica contains only the symptoms of the beginning of the disease, not the disease, not the picture of the disease pathology. So our Macramedica contains only the symptoms of the beginning of disease and not the picture of the disease pathology, which only deals with the ultimate of the disease process. So, in our homeopathy, according to homeopathy, the disease means that there is derangement in vital force that is caused by the inimical dynamic influence called miasms, and after that, the disease arises. And we have medicines and we have the symptoms of medicines of those beginning of disease, those process from which it arises, and after that, it shows the sign and symptoms. Vital force tells us that I'm suffering through sign and symptoms, and we have medicines for those conditions in the beginning of the disease. But the disease pathology, the organic changes, is the ultimate result of disease process. After the disease reaches to its certain limit, and that is the result. The result it produces, that is the organic changes. That is the tissue or affect the organs or tissues. So we don't deal with those results of diseases. We only have the symptoms of beginning of the disease. So in these incurable cases, because these cases the organic changes are already happened, so we can't do anything. That is the irreversible organic changes. So these cases are incurable. We just have to try palliation. Um, uh, we just can give the patient a temporary relief. So we just have to try palliation based on the local organic symptoms by medicines in food, crude form or in low potency. In cases where exciting and maintaining causes still persistent. Example, a person complaining, so to understanding these cases, there is an example that a person complaining of severe bouts of cough visits a homeopath. On inquiry, it was found that the cause of his habit of smoking, as he's a chain smoker, is the cause behind that cough, and there is no any other cause. So here the treatment of the condition is stoppage
हेलो
of the
दी,
habit
आपका
of
आवाज
smoking.
नहीं आ रहा है.
He, he
हेलो.
Hi, Sujata.
stopped the uh, he
Sujata?
stopped
Sujata?
his habit of smoking.
Hold on, I'm trying to fix this.
Then
Sujata, can you hear me?
only the cough. Uh, so can do homeopathy like this.
Sujata,
Yeah,
sorry,
ma'am. Yeah.
this entire page got disturbed. We could not hear anything you were saying. So can you just repeat that? This whole slide on cases where exciting and maintaining causes still persist. This example you're giving on the smoking habit and exciting factors, no? Exciting causes. Can you please repeat it? Because your voice wasn't clear at all. Can you hear me? Sujata, hello? Sujata, can you hear?
I think she's just come back on.
Ah. Should I call her on a phone?
Yeah, I think her PowerPoint.
There's a break in the
Yeah,
connection.
break.
Okay.
She's coming back.
Okay. I think she's back on.
Ma'am, am I audible
Yeah.
now?
Sorry, there was a complete break in the connection. The slide on exciting factors, no, that wasn't clear at all, where you were giving an example on the smoker. Can you repeat that slide?
Okay, ma'am.
Yeah. Can you repeat the slide, please? Because we couldn't hear anything.
Okay, ma'am.
Yeah. Thank you. No, you can just repeat the explanation on this.
Ma'am,
Yeah. Tell me.
ma'am, am I audible
No,
now?
now you are. Can you repeat this slide? Can you repeat the explanation on this slide? Exciting and maintaining causes still persisting. Can
Yeah,
you
ma'am,
hear
I
me?
can repeat.
Yeah, please repeat
Yeah,
it,
ma'am,
no?
I can
Because
repeat.
we could not hear you.
Yeah, ma'am, I can.
Yeah, please do it.
Okay,
Ha,
okay,
carry on.
okay, ma'am. So, uh, in limitations of homeopathy, there is cases where exciting and maintaining causes still persisting, then uh, their homeopathy can do anything. Example, a person complaining of the visits that habit is the cause this cough condition and smoker, and there is no any other cause behind. Here, the treatment of the condition of his cough is the stoppage of his habit of smoking and not the intake of drugs. So until he stops his habit of smoking, as he's a chain smoker. So if he continues his habit of smoking, then homeopathy can do anything. Not no any other drug can do anything. So first he has to stop his habit of smoking. So that is the maintaining cause here. That is the exciting cause, and also that is the maintaining cause. So from the hygienic requirement like that exciting causes of like deprivation from the physiological and hygienic requirements, overexhaustion or exhaustion of body elements or tissues, injuries of any form, etc. If they are all present, they are continue to present, they are the maintaining causes, then until we remove this maintaining homeopathic remedy can limit immunity. There is cases for vitality. So we all know that after administering homeopathic medicine, it produces a similar type of in its primary action. It produces a similar type of um, um, disease that we call the medicinal disease. And as it responds to this primary action of homeopathic medicine, the vital force produces a response to take place. Hence, vital force could free from both the medicinal disease and the natural disease. So, the cure is possible because of the secondary curative action, secondary curative response of that vital force, of the vitality of the patient. So, that means it is the vitality of the patient that, that will cure the condition. So, but if the vitality has gone beyond the stage of being activated by a dynamic stimulus, that is our homeopathic remedy, and refuses to dose up, then there is hardly any scope of cure by homeopathic remedy alone. Homeopathic remedy alone, if the person's vitality is reached to a certain stage, beyond that stage, it can be activated by that homeopathic remedy, and it refuses to rose drops. Then homeopathic remedy alone can't do anything. It needs the aid, emergency aid. It needs the other measures that is suitable for that case. And after that, homeopathy remedy can act. But homeopathy remedy alone can't do anything if there is very low vitality of patient, of that individual patient. Example, in cases of disease, the role of the powerful material substances like steroids, medication, the capacity of a person, artificial drug disease, prolonged usage, that is the habit, there is the prolonged usage of powerful material substances like the steroids, the immunosuppressive medications, etc., then the vital force just depresses. There is low vitality in that individual person. And the second example is that prolonged usage of allopathic medication will make the patient the drug. During homeopathic treatment, stoppage of such drugs will be difficult or almost impossible. Like if some person taking hypertension or diabetes drugs, then it is check up that person. He is addicted to that allopathic drug, and during homeopathic treatment, stoppage of such drugs will be difficult or almost impossible because that person's body is addicted to that allopathic drug. Then, in some medico-surgical, obstetrico-surgical, and gyneco-surgical cases, homeopathy has limited action. Example: advanced stages of appendicitis, chronic duodenal ulcer, gastric ulcer, prolapse of uterus, etc. But primarily, they are under the scope of homeopathy because we all know we have so many medicines for appendicitis, duodenal ulcer, gastric ulcer, prolapse of uterus. But in the beginning stage of the disease, if the disease is in the beginning stage, then homeopathy can act, homeopathy remedy can cure. But if that condition is too advanced, so that there is perforation take place in the uterus or appendix ruptures, then homeopathy can help. It needs surgical aid because it becomes an emergency case, so it needs surgical aid. But in its beginning stage, homeopathy act. But if it becomes so advanced, so serious that there is perforation happens, there is appendix ruptures, then homeopathy can help. It needs surgical aid. And cases lacking in any vital organ. Example, a person whose spleen has already been removed surgically, then homeopathy has limited scope because we don't have any medicine in homeopathy that will create that organ, that new spleen or new kidney. So such patients may be palliated from time to time, but complete cure is impossible. These medicines that they prove any medicine given in any potency, especially in higher potency. We all know that those patients are hypersensitive and they prove every remedy they get in higher potency. So, in those cases, we can start from lower potency as in posology it is mentioned. So, the drug application nature, that is the nature's law of cure. So, homeopathy system totally solely depends on the natural process. So it has limited induced what are the natural processes, and homeopathy system go, can apply our drug against the natural process. So that's why we don't have a drug for contraception, anesthesia, and drug induced abortions, etc. Limitations according to the homeopathy symptoms of female symptoms. So this is the limitation of our Macromedica. Then selection of the most similar medicine out of many apparently similar one is very difficult. treatment on the basis of totality of symptoms made homeopathy, because we all know that in homeopathy we have to choose the remedy based on symptomatology, based on the totality of symptoms. So treatment on the basis of totality of symptoms made homeopathy detailed and patient's testing affair. Conclusion is that while gross pathological tissue changes, organic lesions, morphological disproportions, and the physical effects of mechanical causes are not primarily within the domain of similia, not primarily within the scope of homeopathy, and are not therefore the object of but the morbid processes from which they arise, the disorder, the disease process which ultimate result is those pathological tissue changes. We have our remedy to act on those beginning processes, beginning stage of those conditions. So the morbid processes from which they arise or to which they lead are amendable to homeopathic treatment. So this is the conclusion that this is the limitation and this is the scope. So thank you. I tried to put that in short that topic. So I hope that is helpful.
Yes. So, firstly, we apologize for the break in the network. I don't think it was very clear today. There were some interruptions, but otherwise, it was a very good slideshow, and we got a lot of information about the scope and limitation of homeopathy. We welcome you all to please come forward with all your queries, your doubts, your questions, anything that you want to ask. Even the slides that were missed out in between, we'll be happy to repeat them for you. So one by one, if you can type your queries, I can answer them one by one. Again, apologies for the breakup in the network. Sometimes it just happens and there is no control over it. Yeah. So I think there is one question from Shreya Sharma. Why is it difficult to cure idiosyncratic patients? So idiosyncratic patients are extremely sensitive. They react to everything. That is their basic constitution. So even if you give them relief, they are sure to it is sure to flare up again after some time, as long as they keep getting exposed to the same set of factors, to the exciting factor. So you cannot cure them because there is an inherent or inbuilt tendency to react to certain factors. So all we can do is we can only keep giving them relief. There is a limitation in allopathy because there are only so many times you can give them anti-inflammatory or anti-analgesics or paracetamol. But in homeopathy, you can at least help give them remedies that suit their constitutions and also for them to not react as often. Maybe we can decrease the frequency of reactions so they have relief for a longer time. But it's very difficult to uproot the disease from its, to annihilate the disease from its root because they have an inherent tendency to react and be sensitive. Okay. Rinki Bansal is saying, ma'am, cases with very low vitality. Can you repeat this slide? Yes. Sujata, can you please put that slide on low vitality, the limitation of homeopathy?
Yeah.
Hmm. Yeah, so Ritu is asking us whether we can share the presentation. The entire slideshow will be available for you to refer to. If you're registered, it will be available on the website afterwards for you to read. All of it will be available. It is an important topic. It is an important chapter in Stuart Close. And yes, I know it comes frequently in the second year. So you must understand that what are the scope and limitations of homeopathy. Yeah, cases with very low vitality. Homeopathic medicines produce similar type of primary action after the administration. As a response to this primary action, the vital force produces secondary curative response, hence cure takes place. That means it is the vitality of the patient that will cure the condition. So what does that mean? It means that even though we're giving a medicine, we are also activating the vital force. We are activating it to respond to the natural disease factor. So what happens is the artificial disease agent, that is your medicine, will activate, will kind of bring about a response, will kind of shake up the vital force, so that the vital force is able to respond to the disease agent, the natural disease agent. So cases with very low vitality, it's very difficult for the vital force for it to respond and to react, for it to be shaken out of its state, and for it to react and for it to fight the disease. That's what is meant by cases with low vitality have a certain limitation. But if the vitality has gone beyond the stage of being activated by a dynamic stimulus and refuses to be roused up, then there is hardly any scope of cure by homeopathic remedy alone. So it means that the vital force has crossed a certain limit, has crossed a certain threshold where it cannot return to its original state, original dynamic state of health. So it has gone beyond a certain capacity where it is not as healthy or as normal as it used to be. So it's very difficult for that sort of a deranged vital force to react and to fight the natural disease agent. That is why that is a limitation in homeopathic, uh, in homeopathy itself. So here's the example for that. In case of artificial drug disease, here is the prolonged usage of the powerful material substances like steroids and immunosuppressive medications, etc., which depress the vital capacity of a person. So for a very long time, if you've been consuming antibiotics or corticosteroids or any other immunosuppressive medication, you have already deprived the body of certain natural disease fighting agents. For example, if you've given a lot of antibiotics for a long time, you have depleted the vitamin B12 supplies or the intestinal flora or the healthy bacillus present. So because of which the patient can easily fall sick because of these underlying deficiencies, and it's very difficult to bounce back. It's very difficult to respond to the both the disease agent as well as the artificial disease agent, and for the vital force to return to its old state, because it has been under that pressure for such a long time that it has crossed its threshold and cannot return to its normal. I hope this slide was clear. I hope it was helpful. We repeated that. Okay. So the low vitality slide was repeated. Next question from Soumya is, can you repeat cases lacking any vital organs? Yeah, can we have that slide, please? Cases
Yeah,
lacking vital organs. Hmm. Yeah, I think the slide before that, please. Or is it only one slide? Yeah.
ma'am, it's only
Sorry.
one
Just
slide.
go to the previous one. I'll start with that. Let me
Okay.
just give a background. Yeah. So there are cases which are obviously surgical cases, like medico-surgical, obstetrical cases, or gyneco-surgical cases. And there you have to intervene. It is it is a mechanical process which a medicine cannot work on. So you have to use surgery and you have to aid it with surgery. Sometimes a combined approach is the best approach, and only that can help treat the patient. Primarily, they are under the scope of homeopathy, but if it is too advanced, so that perforation takes place or appendix ruptures that homeopathy can't help, it needs surgical aid. So, yeah, now you can go to the next one. So, in case a vital organ is missing, for example, you've had a splenectomy or you had any other surgery where you've removed the organ. So then at that point, there is very little scope. As it is, it's not just a functional deficiency, it is also a structural deficiency in the body, structural change. So you cannot really expect homeopathy, you can't expect the medicine to do the job of the spleen. So the spleen is missing, you cannot expect the whatever simillimum you have selected to do its job. So whatever limited capacity the body can stay within, it's only within that capacity that it can function or it can fight the disease. So the body has to learn to cope up without the presence of the functions of that organ, and therefore if there's a lack of any of the vital organs, there's only so many things that the body can do. The medicine cannot do the job of that organ. So patients in such cases can be palliated from time to time, but they cannot be completely cured. It's quite obvious because you can't cure a person who doesn't have a spleen or who doesn't have part of their intestine or part of some other part that has been taken out. So it's quite obvious that cases lacking in vital organs can only palliated, cannot be completely cured. Okay. Any other doubts? Any other questions? Most of the time, a holistic approach to treatment is what is helpful. You can't say no to specifically no or strongly no to any one particular system of medicine. Each one has a role to play. Each one has its functions and actions on the body. So we must respect every system. One system cannot say the other system is bad or is poison. So where surgery is required, you must perform surgery. Where homeopathy can help, you must make use of it. Okay, next question is, ma'am, is it possible to cure chronic diseases with homeopathic medicine? So the word cure itself is very debatable because when you say cure, it means uprooting the disease right from from its base or from its foundation. And many times something which you have a question, you want to speak. Yeah, let me just finish this, Soumya, then you can ask the question after that. So many times what happens is the disease has been present in the patient for a very, very long time, for a prolonged period, and it'll have a strong miasmatic background. So at that time, you first try to bring immediate relief in the patient so that they don't suffer the symptoms on a daily basis. Cure will occur if you don't find a flare up of the symptoms for a long period of time. You can say that yes, the patient is by and large cured, but sometimes if there is an exciting factor, sometimes if there is a sudden or very acute exposure, they can be flare up of the symptoms. But those symptoms might only be superficial, they may not be deep. So you can consider that a functional change or a functional disturbance, or maybe an exciting factor, which can or an indisposition, which can be treated even sometimes with a change in habit or change in environment. So yes, cure can be brought about in chronic diseases, but it is very important to understand the extent to which the body is suffering, how much of structural change has taken place, how much of irreversible change has taken place, and what scope we have as homeopaths to help bring relief in that patient. If nothing else, homeopathy is also very good at palliating the patient without any side effects, giving them comfort even in their last stages. So there is always some scope in that sense. Yeah, Soumya, you can ask your question now.
Hello, ma'am. I have this
Hi.
question. While I was attending OPD in my college, so there was this one patient
Ah,
post this, she was suffering from cancer. So she had all the matlab, treatment and everything, but now she wanted to completely get a stable state where she doesn't need to rely upon the medicine anymore. So,
mhm,
what is the scope of homeopathy and limitation of homeopathy in those cases where the person has already been through so much and now the
mhm.
person just wants to live a stable life after all the treatments?
Okay. So what is the sort of cancer that she's suffering from?
I don't remember exactly, but it was basically a very drastic stage basically,
Mm,
because all her skin was everything was it was in a very not so stable stage, because I don't remember exactly the case, because that was in my when I was giving exam, that
yeah.
she was part of this practical session, so I was not able to completely listen to the whole case. But
Ah,
in general, if we talk about the cancer wala part, because we all get so scared when we listen to cancer, because it's like
yeah.
so many things are going on at the same time. So I
Right.
want to ask about the scope and limitation of homeopathy in that
Okay.
case.
Okay. Good question. I'll answer that. So here's the thing. Cancer itself as a disease has various stages, and we all know that. Stage one is quite treatable and quite curable. Stage two also, yes. Three and four, you'll see structural changes. By stage four, the patient can even become terminal. Patient can even see irreversible structural changes, and may not be even be up to the point where they can be cured or treated. So when it comes to cancer, we must first understand that homeopathy does have scope, but we must respect the fact that catching the disease at a specific stage is important. You cannot just come with a terminal stage directly or come with stage 4 cancer and say ask homeopathy to just okay treat it, make us completely all right. It's not possible. All of us, like, yes, cancer is a very scary disease, and most people would resort to surgery, would resort to chemotherapy, would resort to bone marrow treatment first, and then after everything else fails, they'll want to come to homeopathy. Nobody's brave enough or nobody's bold enough to try and reach out to homeopathy at the beginning itself. So that is unfortunately a stigma in the society. It's more a thought process in the society, but otherwise when it comes to cancer, first of all, you must understand what kind of cancer it is, because we have remedies that are indicated for different types of cancer, whether it's sarcoma, carcinoma, lymphadenoma, or whether it is of a particular part, whether it's breast cancer, cervical cancer, intestinal cancer. All these different cancers are there. So you have remedies that are specific for specific kinds of cancers. And if you can catch it at an early stage, if the patient is cooperative enough to come to you at an early stage, there is a lot of scope to treat it because you don't have the side effects of chemotherapy, you don't have the side effects of steroids. Our system just attacks the disease itself and does not make the patient go through all the other side effects and other unfortunate, the processes that other treatments put the body through. And if you can do it in an integrated form, like, do a little bit of chemotherapy, do a little bit of naturopathy, a little bit of homeopathy, then that's a good approach because it is dealing with all the aspects, the side effects, the weight loss, the loss of the drop in the immunity of the patient. So homeopathy is very helpful in bringing back the immunity. And sorry, what was it? There was this doctor who was treating a patient with blood cancer, second or third stage. Is relief possible in this case? Yes, there is scope for relief. There is scope for relief. There is also scope for trying to, bring back the circulation to a better state. It's very difficult to promise saying, yes, I can treat you 100% and bring you back to normal state because there will always be some irreversible derangement in the body. But getting the patient out of immediate danger is our aim, and that can be done with homeopathy. There are a lot of remedies that help treat cancer. So we must try to treat the cancer when it is early rather than when it is too late. Catching it at the right time is the most important thing. I had a patient, I think 5, 6, 7 years ago, who had tongue cancer, like cancer of the tongue. So I was able to treat him quite well with a couple of remedies. So the important thing is to catch it on time. Don't wait to do everything else and then come to homeopathy as a last choice. So that's not fair to our system. You must give it its fair chance and make sure that we have enough time and enough, opportunity to treat it. Rinky is asking, ma'am, what is combined approach? Is it a complete cure? Combined approach is not complete cure. Combined approach is trying to do the combination of systems, homeopathy, allopathy, naturopathy, diet, exercise. So when you combine these things, because each one has its own advantage, each one has its own disadvantage. So if you can make use of all the advantages and try to, like, for example, if one system has a limitation, use the other system which can cover up that limitation, then it is very effective. Then you can, sometimes a case requires, removing certain part of the, say, the intestine, which is cancerous, or removing the malignant tumor. So that is not possible in homeopathy. Whereas at the same time, you can prevent its spread by giving homeopathic medicines. You can bring about relief in the patient who is having nausea, weight loss, hair loss, all the side symptoms. You can help by prescribing homeopathy. So combined approaches by combining systems using their advantages and trying to bring about relief in the patient. Next question is, how will we track down the direction of action of drugs if the patient is using multiple medicine system? So allopathy is very, very mechanical. It's very mechanical in its dosage. You can actually count the dose. You can say, 250 milligram or 100 milligram. So you know what it is going to do. Whereas in homeopathy, you can see the difference in the symptoms. You don't see side effects. So multiple medicine doesn't mean at the same time. Sometimes you might need a little help from here, a little help from there. It is required. You can't say no to it. You can't say that this is poison and that is, that is a magic or something. So as long as the patient's vital stats, as long as the patient's prognosis is good, then you can give credit to all the systems. There's nothing wrong in that. Maybe you can't pinpoint how much homeopathy is done, how much the allopathy is done. The important thing is to bring about relief in the patient. Ma'am, in which cases we use combined approach? You can. I mean, see, cases which require surgical intervention, cases which require, there are cases in cancer which do require chemotherapy. There are cases which require a bit of, you might have to, on an emergency, you might have to give a little bit of allopathy. It's all right. Or a dose or a course of antibiotics, it's all right. It's not poison. And we shouldn't disrespect another system. So if it is urgent, like Sujata said, in very urgent and very acute emergency cases, you do need intervention from other systems. So wherever there is a limitation for in homeopathy, for example, homeopathy cannot I don't know if it is mentioned in one of the slides. Homeopathy also cannot kill the organism, microorganism, the bacteria or the virus. So if a patient is having very high fever and is feeling really uncomfortable, there's no harm in giving a course of antibiotics because it is an obvious limitation in homeopathy where one cannot kill the organism. So you have to use a combined approach. For example, I'll give you another example. A patient with chicken pox. So if you have to give them an antiviral, you give them the antiviral. But then you can give a homeopathic remedy after that to probably bring down the itching and also to prevent any further complications, further infections, further flare up. So like in case of chicken pox, you can expect, like 15 years later, they can have a flare up or they can have herpes zoster. So in those cases, what you can do is you can give a homeopathic remedy to prevent that flare up later because those can become complications and that can be more severe than the original or the first chickenpox itself. So using a combined approach is not bad, but in most cases, if you can avoid mixing your systems, that's better. Can you repeat the scope and limitations of homeopathic materia medica? What do you mean by scope and limitation of homeopathic materia medica? I mean, is it a general topic or is it a specific question that you want? I don't think materia medica itself has, has a scope and limitations. Sorry, Soumya, can you repeat the question? Last slide. Okay. Sujata, can you put the last slide?
Okay.
Can you take some webinar on miasms? Yes, we are going to work on that. It's a very important topic. So we'll probably have 3-4 sessions on miasms. So thank you for the suggestion. Okay, limitations of homeopathic materia medica. So the very obvious and the very prevalent limitation of materia medica is memorizing all the symptoms of all medicines of materia medica. Yeah, it's obvious. You can't remember everything of 400 drugs. Lack of scientific words and expressions. See, in this case, Hahnemann made it very clear that it's the symptoms that we are dealing with, not the disease itself. So he said, even if you diagnose the disease, it has no therapeutic value. You're still treating, say, you're not treating malaria, you're treating the patient, you're treating fever, you're treating chills. So lack of scientific words sometimes. So if you're studying materia medica only with the symptoms, sometimes we get confused. We don't know what disease we are dealing with. It works both ways. You hear the symptoms and you're not able to diagnose the disease, or you hear the disease and you're not able to recall the symptoms, both ways. So lack of scientific words, because they have recorded only symptoms, they have not classified any of those symptoms. Sometimes we get confused in our diagnosis. And at the same time, and after that, we get confused in selecting the right simillimum. So thankfully, we have a lot of clinical materia medicas like Borik's materia medica, where he not only specifies symptoms, he also specifies the disease condition itself in his repertory. So that is very useful. So probably in the later years, we have more of clinical materia medicas, probably after Stuart closes time. So today, at least we have some more scientific words and some more disease diagnosis, which have remedies attached to them. Difficulty in exercising proper control over sensations as expressed during drug proving. Okay, so this is an interesting point because when you're proving a drug, you can probably see the initial stages. Nobody is going to wait for the patient to suffer the entire length of the disease because there's always a risk of, having some irreversible change or probably even dying of it. The exception is like Herring. He proved lachesis to such an extent that he himself became so uncomfortable he could not wear any clothing around which was tight around his neck. So drug proving, we're only able to see the initial stages. So there is not enough evidence, at least in materia medica, where you can't understand enough of the advanced stages. At least there is no clinical recording or proving. So you have to use the initial information given to you, and you must take it forward with that. So these are the limitations of materia medica. But by and large, if your knowledge of the drugs itself is good, then you should be able to select the remedy, and you should be able to progress in your treatment and see how the patient is doing. Okay. Next question. Ma'am, some practitioners give more than one remedy. Is it the right way to cure diseases? It's not bad. There's no right and wrong, but then sometimes what happens is there is one constitutional remedy that will cover the patient's constitution, and cover his tendencies, cover his miasm, cover his constitution. Whereas you might find one or two remedies which might cover his immediate presenting or chief complaints. So, the constitution can probably help keep the patient comfortable for years to come and prevent any more flare ups later. Whereas the other remedy that you select can help treat the immediate symptoms that they have come with. So it's not so bad. Maybe if you give one in a higher potency and one in a lower potency, then you're probably not, you're not disturbing the vital force too much. You're not shaking it up too much with too many artificial disease agents. It will take the impression of the higher potency for a longer period, and the impression of the low potency may not last that long. So it's all right. Sometimes it's okay to choose two remedies. Okay, Ritu says, but ma'am, please don't take it on whole perspective like miasms as are in second, third, and fourth year. Please take it in. Yeah. We are planning to do it over a course of 3, 4 sessions. I think each miasm deserves at least one class, isn't it? So we'll do it. We'll do it in detail, and we'll probably take the first session on miasms in general, then SORA, then syphilis, then psychosis, like that. We'll hopefully satisfy you to the fullest. Okay. Okay, Shreya says in this case, we are not following the law. We're not following the law, but sometimes, the requirement is to bring the patient immediate relief. So sometimes it's all right to give it a little extra support. Like I said, the remedy which is selected with the lower potency and lower dosage, probably the effect will not last very long. The vital force will not feel the effect for too long. It will wear off without any lasting damage. So it's all right. Okay, repeat the slide drug application against natural process. Sujata, can we have that slide, please?
Yeah, ma'am.
Drug application against natural process. Okay. Homeopathic system depends solely on the natural process and the law of nature, so it has limitation in the practice of applying medicines to control the natural occurrences. Example, contraception, anesthesia, drug-induced abortions. So, what is natural? Contraception is not natural, right? You're preventing conception from happening by using external barriers or external methods. So, you can't use a homeopathic medicine to prevent a person from conceiving. It happens. It's a natural process, a physiological process. So you cannot prevent that from happening with the help of a drug. And anesthesia. So if a person is, you cannot make somebody unconscious with the help of homeopathic medicine or take away their sensations. You need a proper anesthetic drug for doing that. Drug induced abortions. So medical termination of pregnancy. Again, you cannot. Yes, I know there are remedies like CKL corn, but then that is a very, very rare thing, and that is only a tendency. I can't say 100% yes, that is going to happen. If I give you sickle corn, you'll have uh, you'll have your miscarriage by third month. So anything that is natural, homeopathy will not be able to reverse the effect, or it cannot interfere and it cannot come in its way and try to do something which is not physiological. I hope that was clear. It cannot have narcotic effects. It cannot have any irreversible effect like this. It's a good question. Any other questions? Anything else? So remember that when you're out for your practice in the future, after you're done with your exams and after you're done with your internship, a lot of people are going to come and say, मैम या सर इसके लिए कोई क्योर रहेगा इसको क्योर कर सकते हैं मेरे पास ये कंप्लेंट है क्योर होगा होम्योपैथी में इसका इलाज है so you cannot directly say yes there is a cure say yes there is a treatment there is always scope to treat it there is always scope to bring relief but never promise your patient saying that I can cure you 100% because the vital force and the miasmatic background will always ensure there will be a flare up later. So, your job is to bring immediate relief and to bring down the frequency of the complaint. Okay. Can you repeat the slides of limitations in materia medica? I just mentioned it, the limitation of materia medica, those few points. Okay, I can repeat it one more time. Can I have the last slide, please, Sujata? So yeah, I had just explained it. So difficulty in memorizing all the symptoms of all medicines of materia medica. This is something that everybody complains about from an exam point of view and from a practice point of view. It's not possible to remember all the symptoms, all the PQRS, all the concomitants, all the modalities, all the constitutions, and of course all the the presenting complaints of all the drugs. So somewhere we're all human. It's not possible to remember everything. Second thing is lack of scientific words and expressions. So, like I said, during Hahnemann's time and during source books like Hahnemann, Herring, and all, they all wrote down the symptoms. They never wrote down the diseases. So, whether you study fever, chills, malaise, and the periodicity, you have to just know those symptoms. He's never mentioned that this is malaria. So, lack of scientific words. You have to use a little bit of your own common sense. You have to use your own medical background. That's why we all are studying other allied subjects like pathology and medicine, so that we know what the drug picture is about, what it is talking about. So many times in materia medica, there is a lack of scientific words on expressions. So sometimes we are left guessing what the disease can be, what can be happening in the body. It's not just a group of random symptoms. It is because there is a specific ailment or disease happening, which is why these symptoms are occurring. So, like for example, in argentum nitricum, the symptom is the patient talks in a drunken stupor. It's not just one fine day a person wakes up and starts acting in a drunken way. It means there has been some stimulants that he has been taking, or some suppressants, or some alcoholic habit that has caused him to behave like this. So you must understand there is always a scientific cause, there is always a pathogenetic cause which is causing all these symptoms. But materia medica, at least the older books don't explain it. The later books like Borick and Farrington at least mention the clinical diagnosis. Okay, I think we missed out two more points. Very few female provers with deficient knowledge of anatomy and physiology of sexual organs, leading to incompetent observations. So when you're proving on a female, when you're trying to prove a drug on a female prover, sometimes she may not be able to understand which part of her reproductive system the derangement is occurring in, or what kind of symptoms are occurring. So she may not give a very good reading. It is important to know, but then sometimes if they're not able to explain, then that can cause a limitation. And selection of the most similar medicine out of many apparently similar one is difficult. So, firstly, Sujata, thank you for quoting me in the beginning, saying one medicine for many diseases and many drugs in. Yeah, thanks a lot. I myself learned this from a third year lecturer in my college. So, it was a very nice point and it stuck with me after that. So that can be both an advantage and disadvantage, because sometimes you have a case in front of you, and many times you think, oh, there are at least five remedies that are matching. What should I select? Because in one the constitution is matching, one the modalities are matching, one the chief complaint is matching. So what do you select? I'll give you my own example. Like 2 days back, I had a patient with tinnitus, and there were so many remedies that were matching his complaint. So then I had to go through my own, materia medica to select the remedy finally. So sometimes, selecting the simillimum can be a little challenging, but follow your instincts and follow the one that matches the maximum number of symptoms. Okay. So that was a repetition on the materia medica. Okay, Ritu says, I have received questions like this, and most of the girls of my age are asking me for PCOD treatment in homeopathy. So PCOD is again a lifestyle disease. And if you notice, you'll hear more about PCOD the last 15, 20 years than you probably did, say, 30 years ago. So because of a lot of exposure to processed food, to chemicals, to lifestyles, to sedentary habits, to, foods that contain hormones, PCOD has been flaring up a lot more in the last 15 years. So a holistic approach is required. You treat the symptoms with homeopathy, but at the same time, you must also counsel the patient to follow a good, healthy lifestyle. Eat good vegetables, fruits, holistic, balanced diet, get some exercise, get any other underlying condition like thyroid checked, hormones checked, tested. So if all these things can be tackled with in a holistic way, then you can bring about relief. And many times what happens is the patient can be undergoing mental stress, which even she may not be aware of. So try to take her case, try to counsel her, try to find out the underlying cause. It usually gets better with age, unless, the PCOD is also, has an obstacle like a fibroid later to, prevent it from getting completely better. So give a lot of lifestyle counseling to these young girls. Many of them could even be anemic, because in our country, nutrition is a problem because of lack of money. So give them a lot of counseling, make them eat well, tell them to stop having Maggie, first of all, especially hostelites. That's one of the things that, everybody overdoses on, I'm sure, in their 20s. So ask them to eat healthy, wholesome, fresh fruits and vegetables, have a lot of protein along with your homeopathic remedy. Does homeopathy have scope in neurofibromatosis? Again, if you see structural changes, if you see any irreversible changes, that may not be possible for us to return it to its original state, but at least bring about some relief on a day-to-day basis. And secondly, you can retard the progress. For example, if it's progressing really rapidly, you can at least slow it down. Some of these complaints are degenerative, whether you like it or not. The body cannot return to its original healthy state. It's only going to keep getting rapidly worse as the person ages. So what you can do is you can slow the process. Instead of them deteriorating in 10 years, you can at least make it 20 years with the help of homeopathy. So the scope is only this, that you bring symptomatic relief and you delay the process in most of these degenerative conditions. What else? Any other doubts? So remember to answer, in a very just remember that you must respect other systems of medicine. You must not say that, oh, allopathy bekar hai, ya, Unani or Ayurveda is useless. Don't say that. I mean, every system has its advantages. Every system has its uses. The same way, even our system has its limitations. So don't promise a cure immediately to your patient. Just tell them there is treatment. There is scope for you to get better. And that's what the patient wants to hear. So what you do is you should give them hope, give them a sense of security by saying, yes, we have treatment in our system. Secondly, thanks to the internet, everybody and anybody is able to read about our system on the internet. But most of the time, it is a half information. So that is more dangerous than not having any information on homeopathy. And most of these so-called experts are people who don't know anything about homeopathy. So be nice to them. Don't get offended if they come and say something something which isn't correct or which is incorrect information. Correct them, teach them, use the opportunity to tell them that yes, this is what we can do in our system, and let's have a chat and sit and talk to them. Don't get offended, because most of the time they have only half knowledge on our system. Okay. So in our OPD, there is a regular patient having PCOD since 2 years, normal hormone levels, but weight is 64. The major problem could be weight by looking at the history. Okay, so weight, it could be both, right? It could be PCOD causing the weight gain or weight gain causing the PCOD. It could be either way. So ask her to regulate her lifestyle by eating well, getting some exercise. Hormones are very temperamental. See, they get influenced by a lot of external factors. So try to bring the hormone levels and the effect of the hormones by changing the lifestyle. It's not easy. It's a lot easier to just pop some medicine and think that it's going to work. The more difficult part is to try to maintain your diet, try to get some exercise, try to get some sleep, try to keep away from junk food, try to bring down stress levels, try to avoid bad habits like drinking 10 cups of tea, 10 cups of coffee, smoking, drinking. So it's a lot more difficult to regulate your lifestyle than to actually just sit and pop a medicine. And so you should tell your patient that the medicine can only help you so much. You have to bring about your lifestyle, bring it back on track. And the lifestyle change can cause can last a lot longer in her life and benefit her for a longer time than the medicine itself. Thank you, Rinki. Very nice of you to give us that feedback. It's very encouraging. And please come forward with any more topics that you would like us to cover. I ask you all to be patient about miasms. We will deal with it. We just need to prepare, and we want to plan it so that everybody is satisfied with the explanations. Anything else? Any other doubts? So good luck with all your practice. Remember that there is more scope than limitation in homeopathy, and every system has its pros and cons. So don't treat it like a miracle, magical thing, and don't treat it like it's nonsense at the same time. It has to be balanced. And even our stalwarts were aware of the scope and limitations. So we have to respect that in our system. And if you believe in your system, the people around you will believe in it, if you are convinced by it. If you yourself seem doubtful and seem hesitant, they'll say, okay, the doctor itself doesn't know, so system kharab rahega, usme koi fayda nahi rahega. So you should have faith in your system. One of my seniors, like again, I'm quoting somebody, but one of my seniors in college used to say that this is your bread and butter. Because we all used to study pathology, we used to study surgery, obstetrics, we used to study physiology, and we used to keep materia medica aside, thinking that exam, say, ek raat pehle, we'll just read a little bit, go write some story on materia medica and pass the exam. But that's not the case, is it? Today, you have to struggle to find a simillimum. You have to struggle to remember the symptoms. So remember that Materia Medica is also very important. It's the foundation to our practice. And a sound knowledge of Materia Medica will help you, half your work get done. Case taking is also important. But then after that, you have to select the right simillimum. So don't get confused. Read it well, read it from the beginning, and try to relate. So if that is all, I would like to close today's session. It was a very good session. Sorry for the bad network, but I hope I have cleared doubts after that, whatever was missed out. Come forward with any more queries, any more discussions. We are open to it. And we'd like to have this as a, as an interactive session rather than just a one-sided thing. Let me just share my email ID so that if any of you want to contact me for further queries, you can write to me. My name is Deeksha, and here is my email ID. There. So anybody who wants to, to clear any more questions can write to me anytime. Okay, if that is all, I'd like to close today's session. Thank you so much, Sujata. Can you just share your email ID? Sorry. So you people can contact either of us for any further discussions or doubts. Yeah, this is Sujata Mohanty's email ID. So she's also available and very active on Instagram with her notes on homeopathy. So please do contact either of us. And we look forward to you all joining us for future sessions, future webinars, for future doubts. Keep us on our toes, keep us challenged with all your questions. We look forward to it. And if that is all, I'd like to wish you all a good night and see you next time.